let's take a moment for ourselves. Breathe deeply, sip some water, and let's begin. Welcome back to Health 24 Hours, your trusted guide to aging well. I'm Dr. Michael Turner, and today I want to share with you something that affects many older adults, often unnoticed and misunderstood, certain common fruits that may be silently weakening your bones and joints. You might be surprised. These fruits are widely loved and considered healthy. But after age 60, changes in our body mean some fruits can actually cause inflammation, worsen joint pain, and reduce mobility. In this video, I will walk you through 7 popular fruits that could be quietly harming your bone and joint health, and what you can eat instead to stay strong and independent for years to come.
If you or your loved ones have been struggling with aches, stiffness, or swelling, this could be the insight you've been waiting for. Let's get started.
Now, let's talk about bananas. Bananas are soft, sweet, and easy to eat, often a go-to snack for many, especially older adults. They're packed with potassium, which is good for heart health and muscle function. But here's the thing. Bananas are also high in natural sugars and contain a compound called tyramine, which can cause blood vessels to constrict. As we age, our blood vessels become more fragile and our joints more sensitive. When blood vessels tighten, less oxygen-rich blood reaches your legs and joints. This leads to stiffness, swelling, and that nagging pain many seniors experience in their knees and calves. Plus, the sugar in bananas causes blood glucose spikes, which fuel inflammation, a known enemy of joint health. In my practice, I've seen many patients who eat bananas frequently and complain about worsening leg heaviness and joint discomfort. So what's the takeaway? Don't avoid bananas completely. They do have benefits, but enjoy them in moderation. Balance your diet with fruits that have less sugar and more antioxidants, like berries or apples. This simple change can help reduce inflammation and keep your joints feeling lighter and more flexible. Having talked about bananas, now let's move on to another popular fruit that many enjoy: grapes. Grapes are small, sweet, and packed with antioxidants, especially resveratrol, which has been linked to heart health and anti-aging benefits. However, grapes also contain a high level of fructose, a natural sugar that can be problematic for older adults.
Fructose is metabolized mainly in the liver, and excessive intake can contribute to fatty liver, increased inflammation, and joint pain. In addition, the thin skin of grapes can sometimes trigger allergic reactions or worsen arthritis symptoms in sensitive individuals. Many older patients I see who regularly snack on grapes report increased swelling and stiffness in their legs and hands. If you love grapes, enjoy them occasionally and in moderation. Choose fruits with lower sugar content and anti-inflammatory properties to protect your joints better.
Moving on from grapes, let's discuss apples, a fruit many consider a daily staple for health. Apples are rich in fiber and antioxidants like quercetin, which help reduce inflammation and support heart health. However, apples also contain a significant amount of natural sugars and acids. For older adults, the acidity in apples can sometimes irritate sensitive joints and digestive systems. The natural sugars may cause blood sugar spikes, which can worsen inflammation and joint pain, especially in people with arthritis. Additionally, some patients report that eating apples, especially in large quantities or raw, can trigger joint stiffness or mild swelling. This doesn't mean you should avoid apples altogether, but moderation and preparation matter. Cooking apples or choosing less acidic varieties can help reduce discomfort. Balancing apples with fruits lower in sugar and acid can protect your joints better as you age. Now that we've discussed apples, let's turn to oranges, a fruit many associate with vitamin C and immune support. Oranges are indeed packed with vitamin C and antioxidants that help fight inflammation. However, their high acidity can be a problem for aging joints and sensitive digestive systems. For seniors with arthritis, the citric acid in oranges may exacerbate joint pain and swelling. Moreover, some patients report that eating too many oranges or drinking a lot of orange juice can lead to increased leg discomfort and stiffness. The sugar content in oranges, although natural, can also contribute to blood sugar fluctuations that worsen inflammation. To enjoy oranges safely, try to consume them in moderation and avoid excessive intake of orange juice. Pairing oranges with low-acid, anti-inflammatory fruits can help protect your joints and digestive health as you age. Moving forward from oranges, let's focus on strawberries, a fruit loved for its sweetness and vibrant color. Strawberries are rich in antioxidants, vitamins, and fiber, which generally support healthy aging and reduce inflammation. However, for some seniors, strawberries can be a double-edged sword. They contain natural compounds called salicylates, which in sensitive individuals may trigger joint pain or allergic reactions. Also, strawberries can sometimes worsen symptoms of arthritis due to their potential to increase inflammation in certain people. Moreover, many strawberries on the market are treated with pesticides, which can add to the body's toxic burden and impact joint health negatively over time. I advise my patients to wash strawberries thoroughly and consume them in moderation. If you notice any joint discomfort or swelling after eating strawberries, consider reducing intake or switching to organic options. Moving from strawberries, let's take a closer look at pears, a fruit many enjoy for its mild sweetness and soft texture. Pears are rich in dietary fiber and vitamin C, both vital for supporting digestion and immune health as we age. They are often recommended as a gentle fruit for seniors because they are less acidic than others like oranges or pineapples. However, there's a catch when it comes to pears and joint health, especially in older adults with sensitive digestion or chronic inflammation. Pears contain a sugar called fructose. While natural, fructose can be hard to digest for some people, particularly those with digestive issues common in aging, such as irritable bowel or slower metabolism. When fructose isn't properly absorbed, it ferments in the gut, producing gas and causing bloating and discomfort. This digestive distress can indirectly worsen joint pain and stiffness. How? Because inflammation in the gut can trigger systemic inflammation, affecting joints and muscles. Furthermore, some individuals are sensitive to certain proteins in pears, which can act like mild allergens, leading to increased joint swelling or stiffness after eating. I've seen patients who, after reducing their pear intake or switching to cooked pears instead of raw, experience less bloating and easier joint movement. Cooking pears breaks down some of the fructose and proteins, making them easier on the digestive system and joints. So if you love pears, don't give up on them entirely. Just pay attention to how your body reacts. Try limiting the amount you eat, cook them before eating, and balance with other low fructose, anti-inflammatory fruits to protect your joints as you age. Finally, let's talk about dates. They're sweet, chewy, and often recommended as a healthier alternative to candy. Many seniors enjoy dates for their natural energy boost, fiber, and minerals like potassium and magnesium. But there's a catch. Dates are extremely high in natural sugars, about 16 grams in a single medium-sized fruit. For older adults, especially those with blood sugar issues or inflammation-related conditions like arthritis, this sugar load can be problematic. Too many dates can lead to blood sugar spikes, triggering inflammatory responses in the joints. Inflammation makes cartilage weaker, reduces mobility, and increases pain in the knees, hips, and ankles. Moreover, dates are dense and sticky. They're often overconsumed without realizing, especially in energy bars or snack mixes. I've seen patients with worsening joint stiffness simply because they were eating dates every day, thinking they were a superfood. If you enjoy dates, limit them to no more than 2 or 3 pieces a few times a week, and always alongside protein or healthy fats to slow sugar absorption. Small changes like this can make a big difference in how your joints feel, especially if your legs have been feeling heavier lately. Try cutting those fruits out for a week and pay close attention to how your body responds. Sometimes, foods that seem healthy might no longer be helping you. If you've made it this far, it shows you truly care about your strength, balance, and independence. Here's the good news. You don't have to fear fruit. You just need to choose smarter. Instead of mangoes, bananas, or grapes, reach for berries like blueberries and blackberries, low in sugar and high in antioxidants. Papaya and pears are gentle on digestion and blood sugar. Avocados, yes, avocados are a fruit, are rich in healthy fats that protect your joints. And cherries, in moderation, can help reduce uric acid and inflammation. These fruits don't just taste great, they help reduce inflammation, improve circulation, and support mobility. I always tell my patients, every bite is a message to your body, so make it a good one. Don't be fooled by sweet labels. You can age powerfully with the right choices. So here's my advice. Start small, swap out one fruit a day, and pay attention to how your legs feel. If you're still unsure, talk to your doctor, or better yet, keep following health facts. I'm here for you.